Good morning. My name is Ronan Sharkey, and I'm delighted to speak to you all today on a hot topic of the minute, which is AI. And I'd like to thank the HealthOne User Group Committee for giving me a chance to speak on the topic today. Before I start, just like to make clear I have no financial conflicts of interest, I have no commercial affiliations with any kind of company or AI app. I am on the HealthOne User Group Committee myself. I recently joined it, and I am a user of an AI scribe, Heidi. So basically today, I'm building on the recent ICGP AI conference, which was a few weeks back, and I'm basically demonstrating two simple examples of AI that we can use or consider using in our day-to-day practice. So we don't really have much time, so we have about 25-30 minutes. It's a quick, simple talk, and then we'll do a little bit of Q&A at the end. And yeah, so what I'm going to do first is just tell you a little bit about myself and how I got interested in AI, and then I'll get into the demos. So yeah, I'm a GP principal. I'm working in Edgeworthstown, County Longford. I'm a GP trainer, and I'm a HealthOne user for over 8 years. I'm, as I said, recently joined the HealthOne User Group Committee, and I have a little bit of experience using AI tools. That's me with my father sometime in the pandemic. So I joined him in 2019 after having graduated from the North Dublin City GP training program. And that's me on the bottom left corner recently leading a team at the National AI Challenge. I am doing some independent research on AI scribes. I've been doing that for the last year and a half. So yeah, that's a little bit of a background for me. So how did I first get into AI? So the first time I came across anything kind of in a real world setting was a friend of mine sent me this article from The Guardian that was September 2020. And that article caught my attention. So it was written entirely by AI, or almost entirely. So I didn't really hear much about AI until maybe a couple of years later. So I came across this article on New York Times. So I opened my laptop one day, this article was suggested to me, and it again caught my attention. So I clicked the article, started to read about it. So this was a piece of art, if you were to call it art, that won a competition in the US. It was $300 or so. Is it art? Isn't it art? So yeah, it caught my attention. My mother's an artist. I grew up in art around my house, so I was a little bit curious about what this technology was. So the app that was used was called Midjourney. I don't know if anybody's heard about that. So I started to use that, and I could see that every time the app was updated, it got better, sharper, and a little bit more improved. So the third time I came across anything AI related was a few months later. So that was November 30th, 2022, the launch of ChatGPT. So most of us in the room have heard about this, and it is an app made by OpenAI, and this was a bit of a watershed moment. So I downloaded the app around December or so, and so that app, by the way, is one of the fastest growing apps of all time. So it took 2 months to reach 100 million users, which for comparison, you can see Netflix, it took 10 years to reach the same amount of users, and TikTok 9 months. So there's something in this app that caught people's attention. So I used that app 2023, started to test it out, personal level, and started to read about it. And I watched YouTube videos, listened to podcasts, read books. An interesting book I came across was Eric Topol's book, Deep Medicine. And I started to come across this term, AI literacy. So basically what that means is our ability to kind of determine if something is or isn't AI, or if it is AI, what are the risks, what are the benefits? Similar to how we have the concept of digital literacy and health literacy. So I wanted to try and build my literacy in AI. And in 2023, there wasn't really much happening in that space. So eventually in 2024, I came across the RCGP doing their virtual annual conference. It was around May that year. And I noticed that the speaker at the end of the conference was talking about AI. So I thought that was quite balanced and methodical and very interesting. And he, in fact, had been using AI in his day-to-day practice for a number of years. So it was a type of machine learning. And after that, then I tried to look further in Ireland, and it was tricky to find courses, but I found a seminar from the RCPI led by Dr. John Sheehan, a radiologist. I thought that was quite interesting too. But I was looking for something a little bit more concrete, So I did the AI and Business Diploma from the UCD Professional Academy. It was a basic course, but then I could feel like building up some literacy around the topic. And then, of course, our own Conor O'Shea, stumbled across one of his talks and it was excellent. And any kind of Conor O'Shea talk I made sure to attend. It wasn't really until I went to the inaugural Global AI conference by the Royal College of Radiologists in London that I could see, okay, there's actually something a little bit more concrete going on here. And I was impressed by how methodical and how much rigor the radiologists were putting into this field. One of the main takeaways I got from this conference, which by the way fell on a bank holiday Monday, I managed to get a discount rate coming over as an overseas GP. But one of the key takeaways I got from it was they spoke about the use of AI scribes in general practice as a kind of a example of how this technology could be used, and was working quite well. Not without risk, of course, but working quite well. And the second thing I remember from this was that the radiologists are accounting for approximately 3/4 of all AI medical devices in this space. So that's American data now, but I suppose they have something to teach us in this space, and I found the conference quite good. Coming back to Ireland, then I wanted something here, and I stumbled across an ICGP email which linked this course to Dr. Guido Giunti's Generative AI Essentials for Healthcare course earlier in the year, which again was really interesting and helped me build some literacy around the topic. So that's a little bit of an introduction into how I've been learning about it. But why is this important? And why is it such a topical piece of conversation at the minute? Is it something that we can use? Is it safe? So there's lots of questions we're trying to figure out the answers to. And I think this next picture doesn't really need much of an explanation. So we're all working quite hard. We have approximately 50% of clinicians' time spent, according to the research, on administrative tasks. So not only that, we have, of course, shortage of GPs, we've an aging demographic, and of course, lots of complex care and chronic care. So is it the case that AI could assist us in reducing this administrative burden? That's one of the questions I'd like to pose today. So now, that's the introduction piece. So the first example I'm going to show you is an example of an AI scribe in action. So I've chosen Heidi to demonstrate this because it's an app I'm familiar with. There are other apps. This is a mini demonstration of a simulated consultation. So please don't critique the style of questioning. Sorry, Greg, I might need your input there. And it's 2 minutes long. So what you're going to see on the next screen is a split screen. On the top, you're going to see the desktop computer the way that it is in practice at the time, and synchronized to the bottom screen, which is the consultation with an actress. This isn't a real consultation, as I said. Actress happens to be my wife. So let's go and see if this works. It should work. Mary, great to see you again. Listen, Mary, before we start, using a digital tool to help you take the notes. All right, so it uses AI and it turns what we're saying into the notes. What I do is I review them at the end of consultation. Once I'm happy with them, put them into your chart and from the app I'm using. So would you be happy enough with that? Are there any questions about that? No, you're okay with that. You can always change your mind. All right, so all right, Mary. So how can I help you today?
Doctor, I'm here today because I have a severe pain in my right knee, and I feel like I've tried everything. I've tried taking the medicine, going to the physio, and to be honest, I feel like the pain just got worse with time. And now it's hard for me even to go to work.
Okay, sorry to hear that, Mary. And how did you get on, Mary, with the medication we gave you recently?
I was taking the medicine just occasionally when the pain was really intense.
Okay, and did the medication work?
I don't think it's doing anything for me anymore.
Oh, okay, sorry to hear that, Mary. Tell me, Mary, what's your biggest concern with me?
My biggest fear is that I might need surgery at some point, because in my recent MRI, you mentioned that there was a torn.
Oh, the chair, that's right. Yeah, you have a chair in your knee for sure. Well, look, what I'll do, Mary, is if it's okay with you, I'll examine me, and then I'll have a couple of suggestions for you. That's
Okay.
okay. So, on the examination, there is deformity, swelling, there's some tenderness of the medial aspects of the right knee, and flexion and extension, both active and passive movements. For those that can't hear, it's not that important what she's saying. It's basically persistent knee pain, right? What's going on here is there's a bit of a tear, and look, I have a couple of suggestions for you on that. So I think we should take the medication a bit more regularly. So I'll recommend an anti-inflammatory. I'd like you to take it every day, a couple of times a day. I think, look, at this point, I think it's a good idea that we get the specialist involved. So would you be happy enough for me to write a referral to the specialist?
Yes, please.
Yeah, I think so. And they'll be able to come back to you with your concerns, and hopefully you'll avoid any surgery there. So would you be happy enough for that?
Yeah.
Okay. So any questions before we go? No. And look, I think you should keep kind of exercising a little bit on the knee anyway. You know, it's good to keep active. And if there's any kind of changes or concerns, anything you're worried about, just ring back to me. All right? We'll have another look at it. Okay? Happy enough? Right. Okay. To explain that, if for those that couldn't hear, basically persistent knee pain requires referral to an orthopedic specialist. That's the take home of that consultation, and don't mind too much on the top screen. That's just what the screen looks like as the consultation is happening. So the next video is going to be important to watch. It's going to show you what my workflow is in using the app, and I'd like you to pay close attention to this. It moves a little bit fast, so when the screen turns to the next video, I need you to look at the top right corner where I'm going to click the stop transcribing button. Sorry, yeah. Good question. So you can see on the screen there, it's a Jabra 510 conference speaker. So it's just beside the phone there. It sits between the computer and the phone. So that's a really good question. And actually, I forgot to say at the start, I have a resource pack at the end. In the last slide, it has links to every app I've mentioned. It has links to research papers, documents from MPS, Medisec, Medical Council. So anything I've mentioned is in that, which you can take at the end. You can take a picture of. It's a QR code. So thanks for that. So yeah, stop transcribing is what I'm going to click on the top right corner. It's going to pop up this window. It's going to work out what it is it thinks that I am likely to need. So in this example, it's worked out I'm going to need to write a SOAP note. Now I've clicked that, and that's what it's producing on the right-hand side. I'm reading it line by line, word for word, to make sure there isn't any mistakes. And once I'm happy with that, what I'm going to do is I'm going to directly copy and paste it, usually 3 or 4 parts, into HealthOne. So I'm just mapping it subjective to subjective for this example, but there's many ways you can do this depending on your workflow. It's basic, it's workflow we can use at the minute. And once I've finished copying the note into HealthOne, I'm going back up to the top right corner again. I'm going to click create. And it's worked out that I'm most likely going to need a referral for an orthopedic specialist. This is real time. This is how fast it does it. And again, I'm reading it line by line, word for word, to make sure there's no errors, no mistakes. Just in the interest of time, I wanted to do it like this. So you may find you might want to take a little bit more time, or depending on the complexity of your letter. So normally I would copy and paste the full letter into HealthLink, but for this demo I've decided to copy it into the note, and I can send it later then, whenever I choose. And I've copied it in 2 parts into chart note for this demo. All right, so that's basically it. There's nothing really fancy about it. You can edit the format so that it isn't a SOAP note. It can be a progress note if you prefer that. And there's lots of other customization aspects to Heidi that you can use and create your own template. So that's basically it. It's a quick demo, and I wanted to show you that just to give you an idea of what it can do. I'm not saying we should be using these apps or shouldn't be. I'm just giving a balanced demonstration for you to be aware of. Sorry, Kevin. Yes, this is the paid version, and I have a comment on that later on, Kevin. Sorry. Sorry? can HealthLink cope with? Yes, it can. Yeah, every time. Yeah. A good question. I can treble check that for you to be sure. As far as I know, and maybe I'll let you. What was your name? Sorry. Okay.
Already, so you will see that it just didn't go. But if the tool and the help is limited, it will be obvious at the time of putting back in. You will see it's just up a certain point.
So
I know that's another problem, but
yeah, it's a good question and a double check. So this is purely demonstration and gives us an idea of how things can be done. So the next piece of information then is, so extrapolating from that and building from the recent ICGP AI themed conference, Dr. Gozi from MPS referenced a research study that showed that not only are these AI scribes saving time, sorry, go ahead. So this is Heidi, and that's Heidi. What it's done is it has recorded, I should have said this at the start, apologies, the consultation, and it has produced an audio transcript. And from the audio transcript, then it formulates a SOAP note. So it's you then, it's from that consultation. So it's the app, that's made the assessment, and then you are kind of signing off on that. So you, to complete that workflow, you need to be happy that that's an accurate representation of your note. So in a way, it is your assessment, but it has produced it for you as an assistant may do, or maybe perhaps a dictaphone might do for you as well. Yeah, it's worked that out. So if I wasn't happy with that term, I would then need to edit that in Heidi, and I have a couple of points on that in 2 more slides. Thank you for the question. So I suppose, yeah, from the recent MPS talk, she referenced a paper which showed that not only are these apps saving doctors time and improving efficiency, they're also reducing cognitive load, and interestingly, they are reducing burnout. So this is new research. We're in the early stages of adoption here, and clearly more work and research needs to be done. But from a personal level, using these apps now a number of months, I can see that in my daily workflow, that not only is it saving time, but it is improving workflows. And then the question is it adding more benefit to the patient? Am I focusing more on perhaps non-verbal communication? Is the patient quality of care going to improve as a result? Perhaps work-life satisfaction or balance may improve, or is it all of the above? So these are questions, and the research is evolving, so it's worth considering. Of course, then we're going to have challenges with any kind of AI adoption. And some of the main challenges that we talk about are consent. So you may not have heard the audio, and apologies for that, but the consent process needs to be done. And is it going to be verbal consent or written? How informed are you in regards to consent? Is there a data processing agreement in place? So that's something you can request from your vendor. So Heidi sent us that. And then we need to be clear on where is the data going, how is it stored, and have you done what's called a DPIA, which is a data protection impact assessment. So if you read the ICGP AI document earlier in the year, that was one of the recommendations made that we should do before deploying any kind of AI technology in our practices. So, and I'm not trying to supposed to be negative, I think these are just considerations for your practice. In using the apps, then they can make mistakes, so they can hallucinate, which means they can put words onto the page that maybe weren't said. And not only can they do that, but they can omit information. So you might have said something that wasn't recorded in that note that you would have seen on the screen prior. And then how accurate are these tools? So MPS and Medisec have reiterated that the user is responsible, so the GP is responsible for the output. And how comfortable are we with that? And of course, there's regulations, and then there's concerns about bias, equity. You could have perhaps an issue with an accent. And is it fair? Does this exclude certain people, certain patients? And there may be some cost considerations for your practice. So there are just some points worth considering, and things I've learned. So in using the app so far, I think it's just worth reiterating the importance of checking the output. They do make mistakes. I know the example was quite quick there, but I would recommend just making extra sure that you're happy with the output of the scribe if you decide to use it. And then if you did need to edit, sorry, did you want to ask something, Matt? Yeah. Mm-hmm. Mm-hmm. Yeah, so if it's a tricky, I suppose we don't have all the answers. I think the GDPR is in place and we need to be extra careful around using these apps. So I think building some literacy around these topics is important and probably the first place to start. And I've listed, as I said, a number of resources there to help you, Matt, with that. Regarding if there is, say, someone else in the consultation, at the time, I think absolutely you need to make sure you have consent for that to be on. And your other question, Matt, was there something else? Does that answer? Yeah. Yeah. So, and we can spend a bit more time on that in the Q&A at the end. Just in the interest of time, I'd like to proceed with the rest of the slides. So, yeah. So these are some practical kind of points I'd like to discuss. And so I was going to say there, if you are editing any kind of output, make sure you edit it in Heidi before you transfer it over. That's very important. And you can imagine if you didn't do that, and if you edited the note in HealthOne and then realized, oh, I might want to go back and do a referral, you would be sending a referral with incorrect, I suppose, information there, posing a risk. So if an edit is required, make sure it's done within the app you're using, Heidi or another scribe. If you don't have time to send the referral, you can send it later, just as I did in the example. And then what I do in my workflow is once the patient has left the room, I delete the audio transcript, so it's gone off the Heidi app, gone off their server, and the patient is made aware of that. I would make sure I edited the notes before doing that step, and then it's important in every consultation that we document consent. So they're just a couple of points to outline. So the second demo is, again, a very brief demonstration. And this is about, again, building from the recent ITGP AI conference. I'm expanding on the idea of prompting and using apps like ChatGPT. So I'm going to call these chatbots for this demonstration. And the chatbots that are on the market are things like ChatGPT and Google's Gemini. They're the two most popular options. There are other options like Claude and Mistral and Perplexity and Copilot. So these apps, before we proceed any further, they're essentially trained on the internet. So they're trained on the likes of Wikipedia and Reddit and YouTube. So if we're ever using apps like this, we just need to be cognizant that that's kind of what we're doing. So you can imagine there's a little bit of risk in doing that. Now, they're also American apps, so they're going to default towards maybe American bias. And it's another thing to consider if we are deciding to use these apps personally or professionally, if that was something we were going to do. So I'm going to just show you what prompting is with a demonstration. So prompting, for those who may not be aware, is what we call when you ask a chatbot a question or if you give it instructions. So there is a little bit of skill around this. It has become its own field. So there's a field called prompt engineering, and a couple of really simple points that are worth discussing are, if we are using these apps and are prompting, it's worth giving a little bit of context about where you are, about what you're asking about, and it's worth giving some detail and being clear about what you're asking about. And another thing that can help you get a better output is requesting some structure. So for example, you might want an output that has a bullet point format, or maybe you just want a one-page summary of of a particular task. So it's easier to see this as, with a demonstration, so I'll explain it a little bit more. So I'm going to show you what would be considered more of a weak prompt, which is lacking those 3 items. And weak prompt, so let's say you're a little bit inspired, you've been to a recent Medisec or MPS talk, and you feel like, okay, I'm going to actually do one of these policies that I've been meaning to do for a while. And you say to yourself, okay, maybe this Saturday I'll spend 3 hours writing a policy. So you sit down and you have your MPS Medisec documents, and you think, okay, I've heard a lot about ChatGPT. I might start using this to help me out. And then you write this prompt: write a policy for managing test results. So that's a weak prompt. It doesn't have detail, it doesn't have context, and it hasn't asked for any structure. So I'm going to show you what happens if you put that into ChatGPT as a demonstration. So this is what it looks like, and I'm going to press enter. This is real time, so it is producing a result quite quickly there. And at first glance, it looks quite impressive. You may not be able to see everything here, but it looks quite impressive. It's got a purpose, a scope, policy statement, responsibilities, but actually, if you look a little bit closely, it's not really of any value. It's in a way kind of rubbish. It's not useful, and it's not fit for purpose. It hasn't referenced anything to do with general practice, and to the untrained eye, that could be something that you might think that's quite good, but in actual fact, it's not really usable at all, in my opinion. So if we were to strengthen that prompt a little bit or improve it by adding a little bit of clarity, a bit of context, I'll show you what the output can produce. And to improve that prompt to the same idea, the same task, what you can say is something like this. So you're telling the chatbot what you need in a little bit more detail. So you're saying, you are a practice manager in an Irish general practice. That's giving it context. Please write a 1-page SOP, with a little bit more detail there, for managing incoming test results based on Irish primary care context. Please include who checks results, when they are reviewed, how patients are informed, and how actions are recorded in HealthOne. Formatted with headings and bullet points for easy review. So that's not a perfect prompt at all, but it is a little bit better. It's a little bit more improved. And if we're using these chatbots, it's important to recognize, remembering how they're trained, is that I would kind of consider these more of like an intern or an assistant, just like you'd ask an intern to produce you a preliminary policy or maybe a first draft. This is kind of the approach here. You're not expecting it to be usable, but you may have something to work with. So let's have a look at what it does with that. So I'm going to copy that into ChatGPT. This is the free version. And again, it's producing the output quite quickly. Similar headings, purpose, and scope. But it's referencing now GPs, nurses, administrative staff, and it is a little bit more usable. So maybe it's gone from perhaps a 1 or 2 out of 10 on the previous to maybe more of a 5 out of 10 or a 6 out of 10. And these make mistakes, you're going to spot some issues with it. And what you can do then is you can prompt it again and ask it further questions and get further information until you kind of get a draft policy or draft idea that can help you. And perhaps then with the output, if you go back to that 3 hours on a Saturday morning, if you did get something usable, maybe the time will reduce from, say, 3 hours to more like 2 hours. And that's often what happens with these AI tools, is that it boils down to the main benefit being saving time. So some of the chatbot, some of the things I've learned from kind of piloting some of these ideas is that, again, like the scribes, you need to really check the output carefully. Sometimes it can make just a really obvious mistake, and it could be hidden within the text. The idea is that if you give a better prompt, which is basically more detail and context, that you're more likely to get a better output. Or to turn it around, you could say rubbish in, rubbish out, which is a common phrase you might hear in this space. Never put confidential information within one of these chatbots. So they go to America, the data is stored in America in ChatGPT. I'm sure it's similar with Gemini by Google. And then, of course, then we need to be aware of these risks. If they make mistakes, they can be inaccurate, and then there's bias associated with using these. So I suppose if we were to use something like this in our practice, I would be of the opinion it may be worth building some literacy around what they can do and what they can't do before kind of considering them. And maybe you could start using an app like this on maybe more of a personal level first before using it in practice, or maybe just testing it on a subject you know about where you can see the obvious mistakes and familiarize yourself with these tools a little bit more. There's also some courses I've linked in the document at the end. So this is a quote I picked up from a recent conference I was at, which was, if you use a free service, then the price is your data. If you pay about €20 a month, then your data is your own. So I thought that was an interesting comment, and I suppose don't want to be negative about it, but it is worth being aware that perhaps we need to consider these if we are using these tools. Like your question earlier, is the app ID, was it a free or paid version? It was a paid version. Do I use the free ChatGPT? I don't. I use the paid version. I think we need to be aware of that. And then this is difficult, so implementing any kind of technology in healthcare is slow. In Eric Topol's book, he says that in healthcare, it's often the last sector in society to innovate. And given the complexity with this, it's worth considering a multidisciplinary team approach. Maybe you may have a team member who happens to have literacy around this, and perhaps you could get some ideas from talking to them. Maybe you could have some team discussions around what AI is or what it isn't. We know our patients are using it, and we know that it is on the rise, so these are things to consider. We can't really do this alone. We're all learning, and it can be quite scary. You might be a little bit fearful of some of the topics, so I think it's worth having this discussion. And then the final slide is more of a question, so I'm just asking really, what would happen if we were to collectively lean into these tools? Would it be the case that if we leaned into these tools responsibly and ethically, that maybe it could save us time, and maybe it might reduce burnout risk, and maybe it could take us back to where we kind of really want to be as doctors, which is spending more time with our patients. So that's the end of the talk. So, yeah, questions? Mm-hmm. You can pause, yeah. Yep. Don't have an accurate figure for you there, but it could be, I'd need to really check that. It could be something like maybe 10 to 30%, 10 to 40%. I'd have to really get data on that for you. It depends, but definitely it may need editing in terms of place names, or maybe picking up Irish names. And the Jabra speaker or any kind of microphone speaker comes up as one of the best ways to mitigate those risks. And I have 2 examples of those linked in this resource pack as well. Yep. Sorry. Yeah. Mm-hmm. 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 Yeah, that's what I do sometimes. Yeah, I think that one of the main benefits is saving time on the referral letter. So even though you're saying you may not be saving time, it's possible you could be saving time on the referrals. I think we just don't really have enough data on this yet, but early research is showing that it is in fact saving time, and it clearly depends on your workflow. But if it was the case that it saved maybe 10 to 30% of your time, that's still substantial. And that paper by that was referenced by MPS they're suggesting that it's approximately an hour per day. So I mean, an hour per day is time saving is worth considering. Now, again, depends on your practice. More research needs to be done. I don't have personal data on that, but there is a sense I can feel that I am saving time. Yeah. Sorry, Kevin. Yeah. Mm. Mhm. Yeah. Mhm. Mhm. Yeah. 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 There are some changes with your workflow. So like yourself, I would have been trying to touch type as much as I can, and now I'm not doing any of that. And I'm picking up on non-verbal communication, and there are changes such as, yes, if you're examining the patient, you need to be clear on your examination findings. So I'm saying those out loud, which is different. And sometimes patients are looking at you, what are you saying that for? So, but there is, yeah, and also exactly with the diagnosis. So if you're using informal language, like you have a tear, you may want to say that out loud, and then how does it impact the consultation? And then it does personalize. So after using it about a month, I noticed this box for personalization, and it does kind of pick up on the edits that you make in Heidi. So it kind of learns how to suit your needs. And there's actually a lot of functionality that we don't have time to go into today, and ways to improve that even further. So yeah, does that answer your question, Kevin? Yeah. Coleman. Oh, sorry. Is the plan of action AI how do you mean? Oh, the plan in the, yeah, so it's the same answer to the previous question. So it has basically made you a note of the consultation, and your job is to then assess that note, see is that actually accurate? Has it left anything out or has it not? So if the plan is Nurofen for a week, refer to orthopedics, but it hasn't put in you wanted an MRI referral as well, then you need to actually put that into the note before you move it over to HealthOne. No, so it can make mistakes though. So it could possibly do that. Yeah, it could have something there, refer for CT when in fact you said MRI. So that's a mistake, and then you need to make sure you've edited that before you copy and paste it over. That make sense? Yeah. Yeah, it can suggest anything. So if you didn't. Sorry, come. Hmm. Oh, I see. Sorry. Yeah. Yeah.
If you don't have to say anything, it may put anterior knee pain without you like so as Robert says, you've got to check.
Yeah. Coleman, one question there, and your hand up. Yeah. Hmm. Mm-hmm. Oh, sorry, Coleman, what do you mean there? Yeah. Yeah. It's just giving you a subjective and objective output. Yeah, and would you be happy with that? Oh yeah, so yeah, so this is where the functionality comes in. So the first window that opened up, it worked out that most likely this is going to need a SOAP note. So in that instance, it made say write a progress note, and it would just be what you have in that consultation, or it might just put subjective or objective there. So, but it could possibly have an assessment there. It could maybe have worked something out. This is an evolving kind of space. We don't know what functionality Heidi may add. They may start adding clinical decision aspects to it. It may start going a little bit off course. So I suppose the only way really is to kind of try and see and test it for yourself. And
The framework and the pipe, I wouldn't recommend using the practice, but in the bed it's download and I've often played in the home, so well they to have a conversation or a meeting to have a conversation. I've done that. I'm glad that.
yeah.
And get it for you. And it will put it into a conversation or a folder for part of the talk. So you could just, start off at the end of, the initial examination. But I think, I'm recommending people do that because I think it is a really important thought because, it's new, it's a bit scary, whatever. I would be 99% certain that in 5 years' time, everybody in the CC is going to use we've got over the regulations, we've got over the new private. So actually, trying to look at this now and understand it absolutely in a very relevant way is important because it is huge. And it's not going to be, there's not a kind of way it's not actually going to be that different to use code to play in the same way as the computer is use code to play. So, I think it is really finding and great job doing that.
Thanks, Karen. Thanks for your support on that. Greg?
Would you try to feed it with actual either blood or results? Because I said
No.
listen to you, but it gives you text, right?
Mhm.
It's not looking
I haven't done that yet. I'm aware people can do that. Maybe others have done that. And if others have more experience in this, feel free to chip in on that question. Did you want to ask something? I can find out, Greg. Sorry. Yeah. No. So the app is to explain that the app is on. It's on the desktop on, and it has a prompt to say consent patient first, and then I have that screen opened, and then that kind of reminds me to consent. I can't proceed further until you click that. So I'm kind of asking the patient then approximately 20, 30 seconds, sometimes shorter, sometimes longer, generally around half a minute. And then once I've done that, I click consent, then it starts recording. That's the workflow I'm choosing. And there's a big debate around whether consent is ongoing. Are we happy with just consent initially? And then do we keep assuming the patient has agreed, or do we keep asking each consultation? And that's something that's up for discussion as well. No, I mean, let's say you've had a consultation and the patient comes back a month later and you wanted to save time, maybe that 30 seconds you want to just proceed. Is that correct? Or is it safer to re-consent again? So that's a big discussion and debate. Yeah. Now customize it so anything actually have the open line yeah. At the back. Yeah. 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 So that should have come across in the demo. So basically, terms that I use are digital tool, and I think it's important to get the term AI in there, just to be clear that it is AI. And depending on the literacy of the patient, we can go more or less. And I'm kind of guided by the questions I'm asked. Then I think it's important to ask: do they have any questions on it? That can facilitate further explanation. But digital tool comes up. Sometimes some other terms have been computer app that uses AI. What else have I come across? Those are the kind of the two popular ones. Maybe other people have better suggestions than that. So there's other ways to consent. I find it's built up my AI literacy a little bit better having the conversations. I've only had one person not be happy, and that facilitated an interesting kind of learning from my angle. You could potentially with time have it in a more, I suppose, streamlined process, and maybe that's the long-term plan here with our pilot, is that once we've done enough verbal consent and hit the majority of the patients, perhaps we might do something more systematic there, like on the website or the waiting room. Pramod, do you want to answer something? Or ask something?
2 points there. One is, so basically, what the AI companies are saying is the value of my data is 0. So, but I thought the difference between a free version of AD or Beauty or then is that the features are more customizable, the features are better, maybe the background, the output is better. So what I'm learning today is that when I put my email into the free version of AD, I told them that put my data as much as you can, and when I paid them to change the contract, now we are saying that we are really like taking the cloud in that server, but we are not using it.
You'd have to check with your vendor. So this is part of why it's recommended to do a DPIA assessment. You need to be crystal clear on what your data is doing and where it's going. And I kind of would kind of strongly kind of recommend that, I suppose, just to be clear before we start using these tools. Different vendors may have different rules, so I would check the DPA agreement. Heidi, send a kind of a template. Yeah.
Fine, they're not using LLM, they're not using your data in code, you will not improve because you're not using your data in the app. You say yes, the data is there, but you're not using the data.
Well, so this is a quote from a talk. We don't really know what they're going to do with our data. So, you know, if it's come up in many of these talks that if you're not paying anything, you know, I think we don't really know what they're going to do with that. They may say that they're not going to train your data, and there may be some settings that you can do with that. So I would just be a little bit careful around that. I don't have all the answers on that, but yeah. Sorry, you want to add something?
The reason why that is because they say that they're trying to start, they're trying to deregulation. They say they don't trace the data. So they don't train the AI model on the data, people. So there is a plan in the NHS to get the everything.
That's happening, yeah.
That was like any service. If you don't pay for service that costs somebody money to us, you are the product, you are not the customer. Same like you're using email that you don't pay for, you are the product. So I don't know how to put it on the give the storage. The storage is already improved from 1 terabyte. But if you use the electricity like over lifetime, you're going to use electricity that and you move on, I don't know. Any vendor you have to support their number one. If there's no number two. I think that's a general call.
Okay. We have two last questions. So just in the interest of time, do you want to ask something? Just yeah. Yeah, I mean, it would be nice to have everything in the one place. So the copying and pasting, is it really that efficient? You know, we don't really know what's going to happen around the corner, but yes, that may be true that other vendors are using different approaches. So I suppose we don't really know. Maybe there will be more functionality in AI in the one house in due course. So yeah, so we don't really know. Your question? Yeah. Yeah. Well, I think that's going a little bit outside my lane for today's talk, but maybe later. Well, I I think, look, we could be here all day talking about this, you know, and maybe that's a question for later on. But look, I think the only thing we can do really is start building literacy around these topics. You know, I'm not a philosopher, I'm not kind of anything beyond a GP, and I'm just kind of demonstrating today 2 simple examples. So maybe we can chat later about kind of using that. Final question? Yep. Oh, sorry. Okay, sorry. So the recordings they're deleted after the consultation by me. That can be done automatically in the app, and you can adjust the time that you want that to be done, whether it's a week or a day. So they're on the cloud, and the servers are in Europe, and so if the note is deleted, it can't be retrieved again. That's a very important point, actually. So I think it's important to delete the note after the consultation, just to get into the habit of it, and then it's gone off the server. Well, I think there are legal considerations for all of this work. Yeah, so definitely, yeah. But again, the MPS and Medisec documents at the end are worth reading, just to be sure on that, and medical counsel. So I think that's everything for today. Neil, thanks very much.